can get the technical things to work. Maybe I can't. There we go. Good morning, everyone. I want to talk to you really about how we can all work together to improve the quality of life for people with dementia. I want to give a very brief overview of the size of the challenge, and I was very grateful to Chris for his point about it's very difficult to live well with dementia, and we all have a part to play in enabling people to live as well as possible with their condition. I want to talk briefly about living well with dementia on a day-to-day basis. People forget the ordinary things that sometimes people with dementia struggle to do and be part of, and we need to help them to be able to live the lives that they want to live. I want to really talk about the role of society in doing that, and each and every one of us has a part to play. And I want to talk also about how we need to plan and do things in the future. So, whoops, going too soon now. The current state of dementia and the size of the challenge. Lorraine gave us a really good feel for the size of the challenge that we all face. In the UK, there are around 850,000 people with a diagnosis of dementia, and the current cost of the dementia to society is £26 billion. And you're probably very much better at maths than I, but that works out at about £30,000 per person with dementia. And that feels like quite a lot of money. However, we aren't working well together yet to enable that £30,000 to be deployed effectively for people with dementia. We've improved a lot, and certainly I've worked for Alzheimer Society for around 11 years, and we're in a completely different place now as a society thinking about dementia than we were 11 years ago, but still we have a lot of work to do. Nationally, the diagnosis rates have improved, but we could still improve those further. In the Greater Manchester area at the moment, they run at about 67%, which is the very top end of the diagnosis levels across the UK. But we could do better. Could we get it to 90%? Could we aim even higher than that? I'm not willing to accept that we compromise on anything for people affected by dementia, and the diagnosis rates is the start of enabling them to work and live well with dementia. So, Dementia 2015 was a report produced that looked at how people affected by dementia and living with dementia actually lived their lives and what they felt about things. So the report showed that 53% said they felt anxious or depressed at some point. And the highest part of their depression, or the highest level of depression, were for people who had recently got a diagnosis. And part of that is natural. That's a very big thing to hear, that you have dementia. And over the time and the lifetime of that condition, you may come to terms with that. But still, we need to be there for people and provide the right services, the right support and the right care from the point of diagnosis right through the experience of the condition. 32% of people said they were not living well with dementia. That's a third. That's 1 in 3 people said they couldn't live well with dementia. So we need to find ways to be able to improve that situation. One of the big frustrations that people shared with us, and 26% of people who did this survey said that they felt they were not involved in decisions that were being made about their care and about their support. They felt as if things were being done to them rather than with them. And we really, really need to look at how we listen to the voice of people with dementia and people affected by dementia. And once we've listened, we need to put into action what we're told. Our findings consistently show that there are gaps between services and what people with dementia tell us they want and they need. So we need to work proactively, and we need to work in partnership, linking up all the things that are available to get rid of the postcode lottery and to enable people to live better with dementia. There is some pioneering work in a number of areas to achieve this, but there needs to be action from the government to drive forward the agenda on integration of health and social care, and we can all play a part in that. So the right care and support, having a diagnosis of dementia and post-diagnosis support is fundamental to living well with dementia. Some people may be angry or confused and frustrated about their diagnosis. Why have they got dementia? Why has this happened to them? And if we're not there to support them in those early days after diagnosis, we can set the path there and set the foundations for them to live well with dementia and to come to terms with the condition. In many cases, people have told us that knowing what is going to happen to them in their condition sets that foundation, and it makes a big difference in their ability to plan and live their daily lives and agree and find ways to change how they want to do things rather than just stop doing things. Prompt diagnosis and access to support, including a dementia advisor, gives people that very foundation and steer through the maze that is care and health provision for people with dementia. Access to dementia advisors has been shown to significantly improve the lives of people with dementia, and evidence from the Department of Health commissioned audit into dementia advisors and their services showed us that people who are in touch with a dementia advisor or a dementia navigator generally fare better in their ability to have a better quality of life, even though they do have dementia. This slide's probably quite difficult for you to see, but it looks like a spider's web, and it is a spider's web. It's the maze of ways in which a person with dementia has to cope with social care, health care, and even some things that the voluntary sector provide. The experiences of people with dementia and their carers depict a complex web of health and care services and staff with whom they have to interact and navigate in order to get the care and support that they need. And all those arrows and diagram on that diagram is a path to a particular type of service. Much of this complexity stems from the difference between the types of care and the range of services that they need, from day-to-day care to managing personal budgets or direct payments, accessing out-of-hours doctors and other things like equipment loans and equipment services. And these are just the things that relate to dementia. The complexity in navigating services is compounded by the fact that many people with dementia may also have up to 6 other health-related conditions. The diagram highlights the complexity and difficulties that people with dementia and their carers face trying to navigate access to vital services and support, in effect having to go through 20 to 25 doors to reach one outcome. Where there are examples of successful integrated care, people are supported better to navigate between these various services they need to use. Where integration has been achieved, the effective joining up of health and social care and other services, this can present, and the presence really of a dementia lead, someone who can be appointed to work with that person and that family to lead and navigate them through that very complex process. And when you get the slides from this presentation, try and follow that route of someone who has dementia, because it is incredibly complicated. As well as a diagnosis of having dementia, to live well, people can benefit from the knowledge that will help them to carry on the things that they want to do in their daily lives on a daily basis. Although plans for the future may change, a diagnosis doesn't mean that people need to stop doing the things that they enjoy, the things that make them them, the things that they experience and get joy from. They may just have to do things in a different way. The Dementia Guide, which I'm going to ask Lorraine to just hold up, please. I did mean to bring it with me, but left it by mistake. So the Dementia Guide is for anyone who has recently been told they have dementia. This could be any type of dementia, Alzheimer's disease, vascular dementia, or mixed dementias. It will also be useful for close friends and family of someone with dementia, and it contains information for anyone taking on a caring role. The guide also gives advice on coping with memory problems, things like keeping a large diary, key cupboards, labels, post-it notes, making the home safer, removing trip hazards, installing carbon monoxide and smoke alarms, automatic timers for plugs, lights, heating, etc. It gives advice on staying active and remaining social and in your social circles, which will help people to retain skills and memory, as well as improving self-esteem, sleep and well-being generally. Doing what people enjoy, even if you have to do it differently. Finally, it also gives advice on staying healthy, regular exercise and eating a balanced diet, help if you smoke to try to stop, regular checkups with your GP, being given the 5-minute notice, as well as regular dental and eye checks. So this booklet should be available to everyone at the point of diagnosis. The role of society and the current achievements that we have achieved. The statistics on the slide are taken from the Building Dementia-Friendly Communities report, which is called a priority for everyone. You will see that 2/3 of people with dementia live in a community. That's in our community. That's in my street and your street. They will take children to the school that you go to with your children. They will go to the pubs that you go to. They are our neighbours and our colleagues. Less than half of people with dementia feel a part of our communities, and really that's something we absolutely need to improve on. Society has a role to play in enabling people with dementia to live better and to live well. Part of the way to tackle this is the development of dementia-friendly communities. This slide is a lovely little picture, and again, it's not good for you to see now particularly, but you'll be able to look at it at your leisure in the slides. So dementia-friendly communities, as we've heard, are villages, towns, cities, organisations, communities, leisure centres, GP practices that meet a set criteria to show a high level of public awareness and understanding, so that people with dementia and their carers are encouraged to seek help and also enable individuals and communities to help someone with dementia. A dementia-friendly community is a self-defining area and one that is determined by local people within that area. We all have a role to play in making our society more dementia-friendly. If we all went away from this conference today and made a commitment that every place that we go to, the local pub, our local restaurant, our takeaway, our dental surgery, our school, our playgroup, our sports club, wherever we go, if the people in this room made a commitment to help those communities become dementia friendly, we would be contributing significantly to improving the quality of life for people with dementia, to enable them to continue their daily lives to a high standard and also enjoy the things that they're passionate about and have always enjoyed through their life. Key roles in dementia-friendly communities. We recently launched a national recognised process for communities wanting to become dementia-friendly to get accreditation, and there are now over 50 communities across England that have formally signed up to this process. 190,000 new dementia friends from private businesses alone, and obviously that's growing daily. Organisations and support from Public Health England, Argus, Homebase, Lloyds Banking Group, Marks and Spencer's, Lloyds Pharmacies have all committed to recruit dementia friends throughout their workforce. This is on top of the 118,000 already existing dementia friends from businesses. There is a dementia-friendly finance service charter which has been developed with over 20 financial institutions and can work to become dementia-friendly themselves. Dementia resource suites for schools. We heard Chris talk about the importance of education for the next generation to ensure that they understand dementia much better than the current generations do. There are 140 schools in England who are using the dementia suite, which will increase over the next few years and enable other programmes to develop from that. Publication of evidence about dementia-friendly communities. In September 2013, Alzheimer's Society held the first ever national conference on dementia-friendly communities, including the publication of a report providing evidence about the factors and priorities that people with dementia say may help them in a dementia-friendly community. Is your organisation dementia-friendly? Is your department dementia-friendly? I would love you to go away from today with a commitment to make your little world dementia-friendly, your work world and your leisure world, and that will make such a difference to people affected by dementia. I have to go very quickly now, which I will do. Dementia Friends, we want to achieve 4 million Dementia Friends by 2020. Are you a Dementia Friend? Go up to our stand on the 3rd floor upstairs and become a Dementia Friend. It's very easy, a small amount of online training, it's fun, and that will enable you and equip you to start to build your dementia-friendly community. Building blocks for people to ensure good quality of life with dementia. We're working with many of the Vanguard sites around integration, and we're also working and heavily involved in the Greater Manchester devolution work. We're bringing the voice of people living with dementia to integration, loud and clear, and ensuring their voices are heard in the planning of all the services that come out of integration. Locally, we're running projects such as Side by Side, which is a social interaction service enabling volunteers to work with people with dementia in the local community to enable them to continue their lives as they would want to live them. So, for example, where I live very close to a local cricket club, and we have some volunteers who enable men generally, although there is one lady, who like to watch cricket and have had a lifetime involved with supporting cricket, to go to the cricket club and ensure that they enjoy their hobbies and their interests that they've always had in their lives. So Side by Side needs to be built upon and should be available everywhere to ensure that people are enabled to continue the lives that they want to lead. I'm going to skip to pretty much the end now because Ryan Hardy's waving at me furiously. What needs to happen in the future? We need a wider uptake of the excellent examples of the work that we've heard about already and talked about this morning. We need to continually have a national commitment to maintain momentum gained from our successes. We need to elevate the status of dementia to match other health priorities, and there's lots of evidence that we're working towards that. And we need a new long-term vision to provide certainly people living with dementia a better quality of life in the UK. I want all of you to take that ambition away with you today in your heart and in your head and go back and do something about it. Thank you very much for listening.